All right, right now we want to get some more context about a controversial decision on childhood
Yes,
vaccines.
so of course you remember this. Monday, the Health and Human Services Department announced new recommendations for when children should get vaccines and which diseases they should be vaccinated against.
To help us understand what this means for families, we are joined by Dr. Kara Biddle with Children's National Medical Center. Dr. Biddle, thanks so much for being here with us this evening.
Pleasure. Thank you.
So let's talk first, because there's probably a high level for parents who are wondering what changed in these new recommendations.
Well, the federal government has recommended a very significant change in the universal recommended schedule of vaccines for infants, children, and adolescents. They've reduced the schedule quite significantly, eliminating the recommendation for routine vaccination with things like vaccines against hepatitis A, hepatitis B, a severe diarrheal illness called rotavirus, as well as the meningococcal vaccine, which prevents a very severe brain infection that can quickly kill adolescents and young adults.
Yeah, again, so we're talking about these vaccines that are no longer recommended on that list. And it could be consequential if you get one of those diseases. How concerning is this?
It's really disappointing and it's quite concerning because this decision is introducing questions for families who are trying to make the best decision that they can. It will lead to families deciding not to get their kids vaccinated against these vaccine preventable serious childhood illnesses, and that will lead to more kids getting sick and even dying.
You know, when you talk about this, and we talk about this debate over vaccines, there have been so many voices, a lot of noise around this. But for parents at home who are wondering, what do I do with this information? Who's their first line? Who are they calling? Should they call their pediatrician and say, hey, talk to me about what you think I should be doing?
You read my mind. I really hope that the first call that people will think about is to their pediatrician because we have decades of experience with the vaccines. We know how safe they are, and we are continuing to follow the vaccine schedule that's recommended by the American Academy of Pediatrics, which is the one that will really keep kids safe. We're here to answer any questions and address any concerns that parents have about these vaccines and their safety for their children.
Yeah, and Dr. Biddle, on that same note, we know there's a lot of information and, of course, a lot of misinformation circulating right now. So what's the most important thing you want families to understand about childhood vaccines tonight?
Vaccines are safe and they are incredibly effective in preventing illnesses that can make your children sick enough to need to be hospitalized or in the intensive care units or even die. And I don't mean to be overly dramatic. These things are real. Many of you have never seen these illnesses, and that's because vaccines work so well. But we know that as the rates of vaccination in our country begin to drop, we will see these vaccine preventable illnesses again. And that's a really sad state of affairs.
Yeah, we've seen us talking about measles
Yeah.
and how there's been a resurgence of that because of some ambivalence by some to get their children vaccinated, and that cost them mightily with their children's lives. It's so sad. Dr. Kara Biddle with Children's National, we thank you for breaking this down for families.
Thank you.